3 compression tests which therapists can use to correctly identify the most common sources of the chronic headache and the migraine type of the headache. My name is Dr. Turchaninov. I'm founder of Science of Massage Institute located in Phoenix, Arizona, and in this short video we will discuss this evaluation test. One of the major reasons for the tension headache and migraine type of the headache is mild irritation of greater occipital nerve. And the greater occipital nerve is a nerve which leaves upper cervical spine, and then it has very strange anatomical pattern, because normally speaking, nerves like snakes go between the soft tissue to avoid any possible compression forces. In cases of greater occipital nerve, to get under the scalp and innervate half of the head, greater occipital nerve actually need to pierce layers of the soft tissue one after another to get under the skin to innervate the scalp and the skull. From that point of view, even mild irritation of greater occipital nerve by slightly even tense posterior cervical muscles, which all of us suffer at this point, create chronic headache secondarily as a reflex reaction to the irritation of the greater occipital nerve. So from that point of view, greater occipital nerve is very short nerve, but it has very unusual anatomical pathway, and application of compression force along the pathway of greater occipital nerve allows you specifically identify forces which may irritate greater occipital nerve in so-called suboccipital space. So that's what we'll do right now. We will apply 3 compression tests in each point, and if one of the point is positive, if all 3 are positive, that allows you to detect places where greater occipital nerve actually caught by the soft tissues. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. Here is posterior neck. My fingers right now on the occipital ridge, which is the most prominent bone at the back of the skull. At the occipital ridge, we have insertion of all posterior cervical muscles. And our first test is actually application of compression force on the occipital ridge next to the middle line. So this is the middle line when spinosus process of the cervical vertebra is. Here is middle line of spinosus process of the cervical vertebrae, and here is occipital ridge. What I will do right now, I will put my thumb following occipital ridge across insertion of the tendon trapezius and semispinalis capitis into the occipital ridge. So right now my thumb is on the insertion of the soft tissue into occipital ridge, and that from this spot greater occipital nerve goes forward and innervate all tissue all the way to the hairline. So if I put my thumb across the tendon, that's very important. You don't want to put your thumb under different angles. It strictly follow the occipital ridge to be sure that you caught place of insertion. Here is the middle line, so it needs to be on the side of middle line to the side, and that's where you're testing first compression test. And only what I need to do, I need to apply mild pressure, vertical, strictly down. And if this pressure triggers increase in intensity of the headache, trapezius muscle actually puts pressure on the greater occipital nerve. Next area where the greater occipital nerve can be compromised is below occipital ridge. Here, greater occipital nerve piercing belly of semispinalis capitis muscle located under trapezius. So, even slightest tension in the semispinalis capitis will irritate or compress greater occipital nerve. From that point of view, after you detect occipital ridge, you're not applying pressure now on occipital ridge. You go below occipital ridge and you will immediately feel that there is depression because you are under the skull. So right now, again, I keep my thumb across paravertebrals in the cervical area in suboccipital space, and I apply pressure again strictly down, but then I twist my thumb under the base of the skull. In this spot, I'm stressing the place when greater occipital nerve penetrates fibers of semispinalis capitis muscle. So again, it's not going between the muscle, it's actually piercing first splenius capitis and then it piercing trapezius. Our next step will be pressure on the greater occipital nerve may be elicited by another muscle which is even closer to the origin of the greater occipital nerve. It's called obliquus capitis superior. That is one of the most frequent, by the way, causes, because what this muscle actually does, it does fine rotation of our head when we need some kind of fine movements to control eyesight. And it's a relatively small muscle, but what it does, it actually has strategic location in regard to greater occipital nerve. If the muscle even slightly gets shorter, what it does, it caught occipital nerve, put pressure on that, and then as a result of it, you will have headache all the way to the forehead. So the third place where we'll examine with compression test is obliquus capitis superior. Here is occipital ridge, and here is edge of posterior cervical muscle. That's the free edge of trapezius splenius capitis. Right now, my thumb on the side of the posterior neck under occipital ridge, because here is occipital ridge. And what you see here, it's like a little empty void spot size of your thumb. That's where you would like to apply 45 degrees pressure, and you need to lower yourself that your thumb follows the plane of the pressure application. So here is my application of pressure compression test for the obliquus capitis superior. If that triggers pain or any new sensation up to the head, to the forehead, that means the greater occipital nerve compromised by the obliquus capitis superior first. So this very simple pressure application allow you not only confirm the presence of the greater occipital nerve irritation, which is the major reason for the chronic headache and tension and migraine type of the headaches, but it also allows you to detect in what level nerve actually caught. And then by decompressing with a medical massage protocol in each spot which is positive during the testing, you allow decisively eliminate headache, not reduce intensity, but actually reset entire suboccipital space, free nerve from the pressure, and restore normal function of cranial aponeurosis and soft tissue in the posterior neck and the head. These three tests as a part of medical massage protocol, which Sami was teaching entire physical therapy department in Barrow Neurological Institute to help patients with chronic headaches. So, do you have experience with successful management of chronic headache and migraine type of the headaches? Then leave your comment below and we can exchange mutual experience and grow together. Thank you for watching, and let's work together to bring your practice into successful medical massage field.